The NHS is in the middle of its worst winter in a generation. Hospitals are at a breaking point, with nurses and junior doctors bearing the brunt and resulting in strike action for the first time in 100 years. The number of doctors and nurses leaving the NHS are reflecting this feeling. In fact, 2021 hit a record high in the middle of a pandemic, with 40,000 nurses leaving, equating to 1 in 9, and we're yet to see the numbers from 2022. According to the Royal College of Emergency Medicine, between 300 and 500 people are dying as a consequence of delays and problems with urgent and emergency care each week. Well, in 2021, NHS staff received a 3% pay rise. While inflation currently sits over at 10%, they're demanding more now. But the government say they're investing in the NHS, the highest spent on health and social care in any government's history, and claim there continues to be record numbers of total nurses and doctors. But workers say the NHS is on its knees now. And I spoke to a doctor about their experience, how they're feeling about the level of care they're providing patients under such tough circumstances, and what they would say to the government right now if given the opportunity. They decided to keep their anonymity for this interview, however, but here's what they told me.
Rishi Sunak said in his New Year's speech, kind of hold me to account, basically watch the waiting times in the NHS go down, but he didn't really put a timestamp on this. Can it last much longer as is? And if so, how long?
It can absolutely not last much longer. In fact, it stopped lasting a long time ago. Things were at breaking point pre-pandemic, and as predicted, sadly, things have gone beyond this now. The devastating reality for healthcare professionals within the NHS is that of despair. We have seen countless empty promises from the government over the last 13 years. Millions of highly trained professionals are leaving their respective vocations because they simply cannot continue to work in this environment. Suicide rates among doctors and nurses are soaring. I can no longer count the number of colleagues I know who have left the profession for good or left the country to train elsewhere. Waiting times cannot possibly go down if the staff are running like rats from a sinking ship.
What is your biggest concern in terms of the various breakdowns within the NHS system?
My concerns centre around patient safety. I no longer feel able to say at the end of my shift that I have provided my patients with the best care. We have people collapsing on the floors of our emergency rooms. We have relatives, rightly so, in despair to watch their loved ones suffer, sat in a chair in a busy ED, in agony, receiving no care. They are shocked to hear the 22-hour wait times to see clinicians. 4-hour waits in ED used to be the worst case. Now we're seeing patients kept in trolleys for 2+ days at a time without any interventions, in pain. I see my colleagues crying in corridors. We go home after 13+ hour shifts with nothing but a sense of absolute hopelessness, knowing that in just a few hours we must get up, go on as normal and do our best.
And why do you think that the waiting times and the other various breakdowns have been left to get this bad?
Years of underfunding, Tory budget cuts, dodgy PPE contracts, slow but evident moves towards privatisation. This in addition to a global pandemic and a dying economy. We have an enlarging, ageing population. The demands on our services are astronomical, and we simply have not been provided the resources with which to cope.
If you had the platform to kind of directly speak to the government right now, what would your message be to them?
Politics does not interest me, nor does it many of my colleagues. Left, right, central, whatever. We are crying out for help in desperation as a last resort, because we are witnessing immeasurable suffering on a daily basis. It is our duty to our patients to speak out and make our voices known. My message is this: wake up and do something. People are dying and they do not need to be.
Well, I reached out to the Department of Health and Social Care about the claims made in this interview. In a statement to London Live, they said, "We're taking urgent action to tackle the significant pressures facing the NHS following the pandemic, with over 5,000 hospital beds a day taken up by flu patients, compared to just around 50 this time last year." They went on to say, We have made up to £250 million available to discharge thousands of medically fit patients from hospitals into community care settings to free up hospital beds and reduce pressure on the NHS. This is on top of £500 million already announced to speed up hospital discharge and delivering the equivalent of 7,000 more beds using a mix of hospitals and virtual wards. So what do you guys think? How did it make you feel hearing from a doctor firsthand? Is the government doing all they can to prop up the NHS in tough times, or do you think more could be done? Let us know in the comments below.